That publication was a collaboration between us here in Exeter and some collaborators in the University of Maastricht. I worked quite closely with co-author there, Rick Reinders, who did a lot of the machine learning development for that paper. Essentially, what we used was the Parkinson's Progression Markers Initiative cohort, which is a large cohort of newly diagnosed Parkinson's patients that have been followed longitudinally for quite a while now, and looked at the way they changed in their cognition over time, subsetting cases that retained normal cognition or standard cognition, I guess, versus those that developed a significant cognitive impairment over that same time span. What we did then was take data that they had available at the baseline. These included clinical measures, biofluid biomarker measures, such as your classical CSF biomarkers, genetic and epigenetic data. So these are polygenic risk scores, individual risk variants, and then epigenetic loci measured in blood, which DNA methylation specifically, to clarify, which have been previously associated either broadly with neurodegeneration or specifically with Parkinson's disease cognition, and fed them into multiple machine learning algorithms to develop predictive models for overall cognitive change over time based on that baseline measurement. What we find is that different types of data and different algorithms perform differently in terms of how well they can predict cognitive change over time. In particular, we find that clinical data sort of predominates and does the most work in terms of improving predictive performance. But what we also see is with the inclusion of certain biofluid variables as well as genetic and epigenetic variables, we get a slight increase in predictive performance of these models. In particular, we sort of highlight particularly important variables which contribute consistently across multiple models, finding associations of anxiety, smell inhibition, so olfactory impairment, and then a number of cognitive measures, as well as CSF biomarkers and a tentative finding of a particular methylated loci, which appear to have high predictive performance within the models as we've applied them here.